Hi, my name is Allison. I'm a physical therapist with Mallers Swoverland Physical Therapy. Today we're going to be talking about dizziness, vertigo, and vestibular rehabilitation. Vestibular rehabilitation is a specialization within the field of physical therapy, and while most PTs have a basic understanding of the vestibular system, typically additional postgraduate training is recommended to appropriately treat dizziness and vertigo. Dizziness and vertigo are often described as sensations of swaying or spinning, tilting, unsteadiness, and these feelings, they can last minutes, hours, even up to days. So let's talk a little bit about what the vestibular system is. It's part of a complicated network to the brain that tells the brain about the body's position, direction of movement, gives us a sense of acceleration and deceleration. And when our vestibular system is weakened, this can lead to some of those feelings of dizziness and vertigo. As I just mentioned, a weakened vestibular system can lead to feelings of dizziness and vertigo, and this can occur due to different disease processes such as Meniere's disease, vestibular neuritis, and even shingles. Trouble reading or focusing while driving in a car, or noticing dizziness with quick movements may indicate that you have a weakened vestibular system. Luckily, the vestibular system can be strengthened and can be rehabilitated with an individualized exercise program designed by your physical therapist. All right, so now we're going to go through a couple exercises that could be given to someone to help strengthen their vestibular system. So Delaney here is going to kind of demonstrate our first exercise. She has a couple playing cards in her hands. She's going to hold them out in front of her face about 18 inches apart, and she's going to quickly look from one card to the other. And that's an example of our first exercise. All right, so we're going to go through one other exercise together that can be used to strengthen the vestibular system. Delaney here, she's going to walk in a straight line. As she's walking, she's going to slowly turn her head to the right and the left. Feeling all right? Good. All right, so those were just a couple exercises that can be used to strengthen the vestibular system, but it is important that any exercises done for the vestibular system be done under the guidance and supervision of a physical therapist, because if they're not done correctly, feelings of dizziness and vertigo can actually increase. So to recap, vestibular rehabilitation is a specialization within the field of physical therapy. However, there are other causes of vertigo and dizziness besides what we talked about today, including issues with the muscles and joints of the neck, as well as other underlying medical issues. So if you think that you or someone that you know could benefit from vestibular rehabilitation, it's important to seek out a physical therapist who has the appropriate training and experience. So that's the end of this video. Appreciate you watching. Be sure to be on the lookout for our next video where we'll be talking about another common cause of dizziness that physical therapists treat, benign paroxysmal positional vertigo, or BPPV for short.